back to our channel, Life Snapshot. Evelyn, Greg and Muttley here from Australia. We've got a nice little channel going here. We talk about our day-by-day life here in Australia, costs of living, some hobbies we do, all sorts of stuff like that. If it's your first time here, please consider subscribing, and thank you very much for dropping by. To all those loyal subscribers so far, we really appreciate. We cannot do it without you. And I thought today, first of all, I'll have one of these. Cheers. I thought today what we'll talk about is what's fact and what's myth in Australia. I got a few comments the other day regarding two subjects that I want to talk about. One is healthcare, and one sort of completely the opposite end of the scale is gun ownership. Okay, now I've lived in this country for now 53 years, going on 53 years. And I have had both. When I was younger, you could own a gun. We used to buy and sell guns. You could get them in the paper. You didn't need a license or anything like that. Well, we had a severe situation here in early 1990s. A couple of massacres actually. There was Port Arthur, and there was also the Strathfield massacre, where a guy had an SKS fully automatic rifle, and pretty much after that we got probably the most strict gun laws there is going around. Now, yes, right, present day you can own a gun, okay, but it's not like, say, in America, where you can own a gun because you want to protect yourself or something like that, or you want it for home defense or something like that. That's not a good reason to have a gun in Australia. You need to pass a strict license criteria. Anyone can get a gun license, but then it even becomes just as hard once you've got the gun license to get a gun. Okay, and I think quite a lot of people, if not most people in this country, kind of agree with our strict laws when it comes to gun ownership. Now, if you're a farmer, if you're in law enforcement, yes, our police do carry guns. We're not like England. If you've got a legitimate reason to own a firearm, then you can obtain a license, and then you can go and get a gun. Like I said, a farmer, security, police, things like that. If you've got a legitimate reason that you need a gun license and a gun, you can have it. But above that as well, there is very strict rules on how to transport a gun, or even have that weapon in your house. Okay, you can't just have it out on the counter. That is strictly forbidden. You need to have a proper gun safe. You need to even have a gun lock. You need to have the ammunition stored elsewhere. There is a lot of strict rules when it comes to it, and I can hear the American people now freaking out about that. Well, that's the way it is here in this country, and like I said, most people, I would agree with that. We still do have issues with crime and guns in this country, but as you can sort of obviously tell, we have a lot less firearm offences because of our strict gun laws. So yes, if you've got a legitimate reason, you can have a gun, but you need a gun license, and you need to go to a gun store. You can't just walk into Kmart and buy one. So you can't just free trade, just put one in the paper or a marketplace or something and sell it. It doesn't work like that. Everything's documented. The gun's documented, serial numbered. The ammunition is serial numbered and documented. So if you go and get ammunition for that gun, the New South Wales or Australian federal government know what ammunition you have, what gun you have, and the police can call you anytime, can come around, knock on your door at any time, and make sure you're practicing the law when it comes to owning a gun, that it's locked away, it's stored safe, and all that sort of stuff. I know American people, I know, yes, you're thinking it's crazy, but it works for us. So, hey, life goes on. So, healthcare. I want to get into the healthcare. This conversation, this subject is being bounced around even by people in this country, and it's quite depressing when it comes to people knowing the true fact about our healthcare. Number one, it is not free. Okay, it's not free. You work in Australia, you earn a wage, you earn any type of living, you earn money. Medicare comes out of your wage as a levy. Okay, it's called the Medicare levy. It comes out, certain percentage of your wage each week comes out of your paycheck. Okay, so our healthcare is not for free. Yes, you can go into a hospital and get urgent surgery and stuff like that in an emergency situation. Okay, and you're not out of pocket, but the Australian taxpayer is. It's as simple as that. Okay, you can also get private healthcare here, right, where you user pays, and you might get benefits like a choice of doctor, a room that's just with you in it. It's not shared room and stuff like that. So people do pay for private healthcare, but the public healthcare system, which is Medicare, is not for free. Taxpayers pay for it. Okay, if you don't have private healthcare and you call an ambulance and an ambulance comes and picks you up, you are paying for that ambulance. I think it's $600 or something like that. So please, when people are talking about this subject, our healthcare is not for free. Taxpayers pay for it. Okay, and we have like what's called as bulk billed. Okay, so you can go see a doctor. You're bulk billed, and most of the time they'll ask for your debit card, and if you just go to see a doctor just for like a checkup or something like that, they will bill you on the spot. Let's say it's $60 or something like that, and then they'll give you an instant refund, and you put your debit card back through the FPOS system, and you'll probably get like $40 back. Don't quote me on the numbers. It all varies depending on what part of the country you're in. So remember that healthcare in this country is not for free. If you're a taxpayer, you're paying for it. So I hope that clears up a couple of things. Anyway, everybody, have a good night. Thanks for supporting us and subscribing. We really do appreciate our things growing a little bit here. Our channel's growing a little bit, and drop some comments. Okay, we like to talk to people and interact with people, especially from people around the other parts of the world. So thanks very much. Stay happy, stay healthy.